We'll talk about prostate today. So, what is prostate? The prostate, it is a conical fibromuscular glandular organ which is surrounding the proximal part of the male urethra, and this urethra is known as prostatic part of the male urethra. Where it is situated? It is situated in the lesser pelvis, below the neck of the urinary bladder, above the urogenital diaphragm, and behind the lower part of the pubic symphysis, and just in front of the rectal ampulla. And on each side there is levator ani muscle. The shape of the prostate is chestnut, and the weight is about 8 gram. The length is 3 centimeter and width is 4 centimeter. And look at that, your width is greater than the length. And in your body, we have several structure which has greater width than the length. These are the cecum, pons, cerebellum, and prostate gland. Now, come to the what are the functions of the prostate. So we are talking about the prostate. So the prostate, it is a gland and it corresponds with the paraurethral glands of the female. That means in female, the homologous part of this prostate gland is the paraurethral gland. Paraurethral gland of the female. Now, come to the what is the function of the prostate. The prostate, actually, the secretion from the prostate, it forms a considerable part of the semen. So the function, it forms a part of the semen, and the secretion from the prostate, it is usually acidic in nature and it contains some chemicals. These are the, it contains acid phosphatase. I am writing in short form. It contains acid phosphatase, it contains fibrinolysin, and it contains prostaglandin and a large amount of zinc. So these are the constituents which forms the part of the semen. So here zinc plays a great role because the zinc, it provides protection of the spermatozoa against phagocytosis in the female genital tract. So just zinc, it plays an important role. And so these are the main function of the prostate. That means it forms a considerable amount of the semen. Now come to the lobes of the prostate. The prostate, it consists of anatomically 3 lobes and surgically it has 5 lobes. So anatomically 3 lobes are 1 median and 2 lateral lobes, and surgically it contains 5 lobes. These are the median, anterior lobe, posterior lobe, and 2 lateral lobe. And the median lobe is situated just below the neck of the bladder. So in old age, due to some physiological cause, this prostate is enlarged, and actually the median lobe of the prostate is enlarged, and in the median lobe there is the median lobe is pierced by the prostatic urethra. So when the median lobe is enlarged, it acts as a ball valve and obstruct the outlet of the bladder as well as the prostatic urethra, so that there will be eventual retention of the urine, and when patient exerts more straining, more pressure, there will be more obstruction of the outflow. This enlargement of the prostate is known as the BPH, or benign prostatic hyperplasia, or benign prostatic enlargement. So in this case, the median lobe is enlarged and it causes difficulty in urination. Now let's see the figure so it will be more easier.